Hello everyone. COVID-19 is a disease caused by SARS-CoV-2 virus of the genus coronavirus. Normally, coronaviruses are not considered lethal to the human beings. They normally cause upper respiratory tract mild symptoms, but COVID-19, a disease caused by SARS-CoV-2 virus, can affect your upper respiratory tract and lower respiratory tract, involving other essential organs of the body. We have already discussed in our previous video that SARS-CoV-2 is one of the 7 coronaviruses that cause severe symptoms. SARS-CoV-2 spread around the world quickly and caused this severe disease, that is COVID-19. It is further studied that it has 2 strains, L and S strain, but still the point is not clear. Symptoms of this virus vary according to the person infected. Symptoms are more intensified in old age people and people suffering from heart disorders, kidney disorders, lung problems, and diabetics, and other chronic disorders. According to researchers, the most common symptoms are fever, cough, sore throat, myalgia, headache, fatigue, and shortness of breath. On finding any of these 2 signs, it is better to quarantine yourself and then call a doctor for complete checkup. As we are not immune to this new coronavirus, symptoms may worsen with time. As this virus commonly travels through the orifices of the body, mainly nose and mouth, physicians may find signs of anosmia, that is absence of smell because of olfactory cells damage, reduced sense of taste because of gustatory cells damage, and sore throat or pharyngitis again because of cells damage of the throat. On examination, we can find congestion in throat, coated tongue, and sometimes enlarged tonsils. Lungs being the more common site for replication of this virus due to abundance of ACE2 receptors on type 2 pneumocytes, signs are more severe, which we have already discussed in our previous video about the cytokine storm and leakage of fluids in the cells. It can land the patient into pneumonia, acute respiratory distress syndrome, systemic inflammatory response syndrome, and pulmonary embolism. On examination of the chest with stethoscope, we see bronchial breathing, wheeze, crackles, and rhonchi. Sometimes due to cytokine storm, some liver cells with ACE2 receptors stop working, resulting in reduction of liver functions. As liver is the site of metabolism, most of the metabolic processes of the body are hampered. Heart, being the vital part of body, functions continuously to keep us function. It is studied that because of cytokine storm, which we have already discussed about in previous video, there is increase in troponin level, which is a sign of injury to the heart cells. Troponin are 3 different proteins: protein troponin C, troponin I, and troponin T. Troponin T binds the troponin components to tropomyosin. Troponin I inhibits the interaction of myosin with actin, and troponin C contains the binding sites for calcium ion that helps initiate contraction. Higher the level of troponin I and T, more is the injury to the cells of heart. Normal range of troponin is less than 0.04 nanograms per ml. It is said to increase with the conditions like heart attack, sepsis, infection of heart, pulmonary embolism, kidney disorders, myocarditis, and many other conditions. On examination, we see hypertension in the patient and tachycardia. The GI tract is another target of the SARS-CoV-2 infection as per some studies. Histopathologically, it was found with atrophy of mucosal lymphoid tissue. Some scientists in their study said that neonatal necrotizing enterocolitis was somewhere potentially related to coronavirus particles in intracytoplasmic vesicles of the damaged epithelial cells. Patients may suffer from features like abdominal pain, nausea and vomiting, and diarrhea. According to some studies, acute renal impairment is uncommon, that can occur in almost 6.7% cases of corona infected. But if it occurs, it carries high mortality, can result in decreased kidney functions like oliguria, anuria, and hematuria. Finally, doing so much damage to the body, it can lead to multi-organ failure. Physician on blood examination can find thrombocytopenia, that is decreased platelets, leukopenia, dearranged liver function test in the form of increased AST, increased ALT, hyperbilirubinemia, increased creatine kinase MB enzymes which are present in heart muscles, increased troponins which we have already discussed earlier, increased urea and creatinine in the blood. In early phase of the disease, when there is reduction in gas exchange in alveoli because of pooling of fluid, there occurs a condition when patient starts doing excessive respiration, a condition called hyperventilation, to throw CO2 out and take oxygen in, resulting in a condition of respiratory alkalosis, where less carbon dioxide results in formation of less carbolic acid, that is H2CO3, ultimately resulting in alkaline pH of the blood, that is respiratory alkalosis. Later on, when the damage increases and hyperventilation also stops, CO2 starts accumulating inside body blood vessels, and increased CO2 combines with more of water, making more and more carbolic acid. Carbolic acid dissociates to make more and more protons, thus reducing the pH of the blood, resulting in respiratory acidosis. And in late phase, there is reduction in CO2 more in the blood vessels, reducing more pH because of less bicarbonate ions, resulting in a condition that is metabolic acidosis. On X-ray, USG or CT, one can see opacity in lung areas on X-ray, consolidation of lungs on X-ray, clots in pulmonary circulation on CT or USG, pleural thickening, and embolism. On ECG, one can see prolonged QT interval, deviation of ST segment, mark ST segment, and arrhythmia. Most of the coronaviruses cause only mild symptoms, but this new virus is very contagious and also has human-to-human transmission. Thus, it is now involving most of the countries of the world. It is said that most of the people revive on their own with mild symptoms like cough and cold. But according to severity of the disease, patients are divided into mild, severe, and critical three categories, out of which 81% of corona-positive patients show only mild symptoms of pneumonia or no pneumonia. Severe conclude only 14% of the total corona-positive patients with the features like respiratory distress due to inflammation and tissue infiltrates. 3 to 5% conclude only critical patients with respiratory failure, multi-organ disorders, shock, and death. Prognosis of this disease depends on various factors like chronic diseases which are related to cell damage, including heart disease, diabetes, lung disease, immunocompromised individuals, already individuals having problem of pneumonia or allergic bronchitis, and age also plays a very important role, making higher age groups more vulnerable to the severe infections. Now, it is being reported that this disease is affecting children below the age of 2 years. WHO has also said that children are affected but have only mild symptoms. But in some countries, it has been reported that features like Kawasaki disease, which is itself a rare disease, are seen in the patients with corona-positive condition. Features like abdominal pain, seizures, rashes, shock, and ultimately collapse. In Kawasaki disease also, there is inflammation of multiple blood vessels, leading to the immune system to overreact. Well, this condition is also a very rare disease condition. Thus, it cannot be said that whether the symptoms are because of coronavirus positive patient are due to Kawasaki disease or due to coronavirus infection. To keep you and your family safe, follow the guidelines given by WHO. In case you find the symptoms of coronavirus, stay calm and try to quarantine yourself and call the doctor for consultation. Thank you and take care.